Hello, once more. I am your host, Mr. Managasali. Hope each one of you had a good day, especially that we, the nurses, were celebrating our special day today. And once more, happy Nurses Day to all the nurses in Zambia, Africa, the world at large. Especially at this moment, I'm sure everyone has noticed that you are special workers or professionals around this time of COVID-19. In that line, may I just urge you to continue working tirelessly and so hard for our people. At this moment, however, I would love us to continue looking at orthopedics, still on unit 2.6, talking about abnormalities of the bones and the joints. So at this juncture, we're going to look at lordosis. Just a reminder, you still remember that the cervical spine is the first part of the vertebral column. Then we have the thoracic region where kyphosis takes place. Then we have the lumbar region now where lordosis takes place. We also have the sacrum and the coccyx, which are actually fused vertebrae. Now, some few objectives under this topic are that the general objective states that student nurses should be able to acquire knowledge about lordosis and how to manage it. Specific objectives are that a student nurse is supposed to be able to define lordosis. A student nurse is supposed to be able to come up with the causes or predisposing factors of lordosis. A student nurse should be able to at least mention some signs and symptoms that are associated with lordosis. A student nurse should also be able to come up with the investigations that are used to diagnose lordosis and then the management of lordosis. So what is this lordosis? Lordosis is an increased inward curving of the lumbar spine, which is usually just above the buttocks. Other books would say it's an orthopedic condition where there is an exaggerated curve in the lumbar region or an inward exaggerated curve of the lumbar region characterized by back pain and discomforting. So the spine has three types of curves: the lordotic curve, which takes place around the lumbar region; the kyphotic curve, which is usually an outward curve taking place in the thoracic region; and the scoliosis, which is usually a sideways curving of the spine. So a small degree of both kyphotic and lordotic curvature is actually normal. But when the curb angle in the two goes beyond 45 degrees, it becomes abnormal. And the other name for lordosis is known as sway back. So too much kyphotic curving causes round shoulders, as we discussed in kyphosis, or hunched shoulders. That's why the other name for kyphosis is actually humpback or hunchback. When you go down the classification or specifications, you can call it Schumann's disease if it is actually caused by that Schumann's condition. Now, lordosis is in the human spine makes it easier for humans to bring the bulk of their mass over the pelvis. This statement means that as humans, we have this lordotic curvature on the lumbar region. For us to have an easy gait compared to other primates. So this allows for a much more efficient walking gait than that of other primates, whose inflexible spines cause them to resort to an efficient forward leaning or bent knees, bent waist gait. As such, lordosis in human spine is considered one of the primary physiological adaptations of the human skeleton that allows for human gait to be as energetically efficient as it is. Otherwise, without that slight lordotic cave, we were also going to be having our knees as we walk around bent like these other primates. Look at the way the monkeys move, chimpanzees. Look at their gait. Usually their knees, they're a bit bent. It's because they lack that lordotic curvature on the lumbar region. So the term lordosis comes from lordos, which is a Greek term, which simply means bent backward. Now, let's look at the causes or the predisposing factors that may lead to one having lordosis. So we have discitis, which is simply a condition where there is inflammation of the intervertebral disc. I hope you still remember your anatomy very well, and the intervertebral disc, which is the disc found in between two adjacent vertebrae. We also have obesity, that I'm sure brings about having too much weight that is actually carried on the lordotic area. You understand with me that the vertebrae that are located in the lumbar region, they are slightly bigger than the rest. Because when we are carrying something on our heads or something heavy, much of the weight is actually taken care of the vertebrae in the lumbar region. That's why if you're carrying something very heavy on your head, you have back pain, because that is where most of the weight is actually taken. So hence, obesity is another predisposing factor or cause to lordosis. Kyphosis can also lead to someone developing lordosis. Osteoporosis, which is weakening of the bone because of the loss of calcium from the bone structure, can also lead to someone having lordosis. Spondylolisthesis is also another predisposing factor or cause of lordosis. Bad posture, just like in kyphosis, can also lead to lordosis. Previous spine surgery, which weakens up the muscles that hold the spine together, can also lead to lordosis. Pelvic or hip injury, which might bring about hip contracture, forcing you to bend in a certain particular way. On the spine, it can also lead to lordosis. Lordosis may also be congenital, meaning that someone can actually be born with that deformity. That's why some books will call it a congenital abnormality. Lordosis sometimes can be genetic, meaning that it can actually run in families. Now, let's look at the types of lordosis. One, we have postural lordosis, just like we had postural kyphosis. Under this one, this often comes from being overweight and lack of muscle conditioning in the stomach and back muscles. When a person carries too much weight in the front, that is the stomach area, it pulls back forward. When the stomach and back muscles are weak, they cannot support the spine, and then they pull from weight. The pull from weight causes the spine to curve forward. So sometimes it can actually also come as a result of bad posture. So we should really pay attention to our posture as we are standing. There is also congenital or traumatic lordosis, as the term says for itself. Congenital meaning that one was actually born with that abnormality of lordosis. When it comes to traumatic, maybe someone was involved in an accident or there was some trauma of the spine, then eventually something happened on the lumbar region of the spine, then eventually someone develops lordosis. Because we're saying there can also be a defect in the way these links develop with growth, causing them to misshapen and weak. With repetitive activities stressing this weak link, they can develop a spondylosis or break in the bone connection. They can also be post-surgical laminectomy hyperlordosis. So a laminectomy is a surgical procedure where part of the vertebrae or spinal bone are removed to give access to the spinal cord or spinal roots. What are these nerve roots? Nerve roots, we are referring to these 31 pairs of spinal nerves. In case the surgical team would love to access one of the 31 pairs of the spinal nerves, especially the roots, then they have to do laminectomy. They have to remove some parts of the vertebrae bones to access the roots of the nerves. So when this is done over several levels in the spine, it can cause the spine to be unstable and increase the normal curvature to be hyperlordotic. So this is not a common problem in adults, and more routinely is seen occurring in children with spinal cord tumors following surgery to remove the tumor. The other classification of lordosis is neuromuscular lordosis. So this group includes a large variety of conditions, disorders that can lead to many different types of spinal curvature problems when the muscles and the ligaments that hold the spine get to weaken, and then the lumbar region decides to curve inward in an excessive manner, then it means someone has developed lordosis. Now let's look at the other type or classification of lordosis, which is lordosis secondary to hip flexion contracture. So this is the unique group of patients who develop a contracture of the hip joint, causing the spine to be pulled out of alignment. This contracture can come from a variety of reasons, including infection, injury, or muscle imbalance issues from several different disorders. Because of the contracture, that being will be forced to curve in a certain way, trying to accommodate the contracture, but eventually they end up developing lordosis. Now let's look at the signs and symptoms that are associated with lordosis. One, they can be appearing sway back. You'll be actually able to tell that someone has lordosis when you just look at their posterior aspect of the lumbar region. So this sway back is with the buttocks being more pronounced. If you view someone from the lateral aspect who has lordosis, you'll be able to tell from the curve that you view on the lumbar region that this curve is more than 45 degrees in terms of the curb angle. Then they can also be having a large gap between the lower back and the floor when lying on your back on a hard surface. That does not change when you bend forward. If you have the normal lordosis or the normal lordotic cave, when you lie down, you'll be able to have the lumbar region or lumbar vertebrae touch the flat hard surface. But if you have lordosis where the curb angle is more than 45 degrees, then we still expect that even if the hand can be able to be squeezed in between the hard surface where you're lying posteriorly and the lumbar region, because there'll be some space there left because of the curb angle, which is more than 45 degrees. Someone can also experience back pain and discomfort. There can be problems with moving certain ways. What are the investigations done on someone with lordosis? History will review family history of lordosis, or maybe there can be revelation of some trauma of some kind that took place if it is traumatic. If it was congenital, then someone will be able to mention that actually I was born with this abnormality. Physical examination, specifically on inspection, there will be exaggerated inward curvature of the lumbar vertebrae or lumbar region. Sometimes on palpation, if it was traumatic, there will be some tenderness from the lumbar vertebrae, lumbar region. X-ray of the spine will review an exaggerated curve of the lumbar vertebrae. Computed tomography, abbreviated as CT scan, will also review an exaggerated curve of the lumbar vertebrae. Magnetic resonance and imaging of the spine will also review an exaggerated curve of the lumbar vertebrae. With these few investigations, at least you'll be able to arrive at the diagnosis of lordosis. Now, how do we manage lordosis? We first managed kyphosis and scoliosis by use of the brace. Even lordosis is the same way. The brace can be used to straighten and immobilize the affected part of the spine. You can still use the Mulocki type of brace here, though you are interested in the lumbar region. But the Mulocki type of brace, remember, it runs from the cervical region, immobilizing it down up the lumbar region. So it is still good. Then you can also bring in the issues of physiotherapy, which can be also incorporated just like we managed kyphosis and scoliosis previously. Lordosis can also be managed by spinal fusion, also known as spondylodesis, remember, and the spondylolisthesis. So for back pain, you can actually relieve that back pain by use of analgesics, as usual. In adults, Brufen 400 milligrams TDS for 3 days to relieve the back pain. Just to emphasize more or to connect the learning to something that you can be able to see, here is a picture of spine fusion that is actually done. So I'm sure you're able to see or follow my cursor there. You can see one vertebra there, one vertebral bone, another vertebral bone. These yellowish parts you are seeing from up there, it's actually the spinal cord running in the foramen there. Then these are actually some roots of the 31 pairs of the spinal nerves. Now, I'm sure you're able to see some bluish structure there, and this pin running from this bluish structure to another. These are actually plates that are actually connected by a pin to immobilize these two unstable vertebrae. This is what we are referring to as spinal fusion. They surgically fused the two unstable vertebrae to prevent them from making unnecessary movements. And there ends our tutorial for today. Remember, in our preamble, we actually wished the fellow nurses a happy Nurses Day. We'll still continue saying, nurses, keep working hard, for you are essential in ensuring that all individuals are in good health. Thank you so much for listening. We still hope to share more in terms of the tutorials. Please don't relent. If you still need some more videos, visit our YouTube channel, look for Francis Muche Managasele, and you'll be able to watch some more videos from there. Thank you so much once more, and have a good night.